So you're not feeling well and you've started coughing. What's wrong? And when do you need to go to the doctor? Let's talk about it. Your lungs are an important part of your body, breathing in good oxygen and breathing out bad carbon dioxide. But when your lungs get sick, all that coughing can make breathing pretty difficult. The airway starts with the nose and mouth. Either can bring air into the throat and funnel it down into the trachea, into the lungs. In the lungs, the trachea divides into two large bronchi, which then further divide into smaller bronchioles, directing air into all parts of the lung. Zooming in, the smallest bronchioles deliver air to the alveoli, the gas exchange part of the lungs. These little alveoli serve as thin-walled balloons where oxygen moves into the blood. The most common cause of coughing is an upper respiratory tract infection, meaning the upper airways, up here, and not the lungs, are sick. Coughs, colds, and flus are your most common causes of upper respiratory tract infections. These are caused by viruses that float around in the community and give you the case of the sniffles. Common symptoms include coughing, nasal congestion and runny nose, sneezing, sore throat, and in the case of the flu, headaches, fevers, and body aches. The best thing you can do is stay home and rest up. Drink lots of water, have warm teas and soups, and mist humidifiers can be helpful. Take it slow and easy, and you should get to feeling better in about a week. However, in the case of a bad flu, high fever, more body aches, and you feel horrible, you can go to the doctor within the first 2 days of symptoms to get tested for the flu, and if positive, they may recommend an antiviral medicine like Tamiflu, which could help you recover faster. But even with the flu, some bed rest and fluids is usually enough to do the trick. And remember, viruses are spread by droplets sprayed into the air by coughing, so cover your mouth when you cough and be sure to wash those hands often. Bronchitis is basically an upper respiratory tract infection that travels down and inflames the bronchi, causing a mixed upper and lower respiratory tract infection. Bronchitis is usually caused by the same viruses that cause your common cold, and in fact, bronchitis often starts off as your typical cold, but then the coughing doesn't go away. Along with the prolonged coughing, you may have wheezing and mild difficulty breathing. Because it's a viral infection, not bacterial, treatment is the same as colds: rest and time. Bronchitis will have you coughing and wheezing for a couple of weeks, but it should get better on its own. But if you start having fevers, or the difficulty breathing keeps getting worse, or if you've been coughing for more than 3 weeks, then it's time to go to your doctor to get checked out. So far, we have talked about viral infections that mostly affect the airways, not the lung tissue itself. But in lower respiratory tract infections, the alveoli, the place where gas exchange happens, are angry, inflamed, and full of infection gunk, meaning your body's access to oxygen is being directly impacted. Not good. Pneumonia is an infection of the lower respiratory tract, and it is usually caused by bacteria. Because pneumonia is caused by bacteria and is directly affecting your ability to breathe, going to the doctor is important. In addition to your coughing, red flags to look out for are fever, difficulty breathing, breathing quickly, and chest pain. While pneumonia can get better on its own, it's a bad infection best treated by antibiotics. It's best to go to the doctor. A side note is that even with antibiotics, it can take weeks to fully recover from a bad pneumonia. There's so much gunk in the lungs, your body needs time to get rid of all of it and make repairs. So it is normal to still have a cough and some mild difficulty breathing for a while. Just make sure that overall you're feeling better and that your fever doesn't come back. A returning fever would be a red flag for needing to go back to the doctor. So that's that. The 3 most common causes of coughing and what you can do about them. I hope this video helped, and I hope you get to feeling better soon. This is Dr. Says, encouraging you to live happy, healthy, and bold. Bye!